this is definitely a very frequent topic. I know that throughout this episode, we're going to be talking about grief with the understanding that you maybe have looked past and recognized maybe you're an older adult that maybe wished you had gone through treatment earlier, or grief as a parent looking at maybe the diagnosis of your child with selective mutism and having to work through that and navigate it. So this client, wrote in this question that says, how do you process the grief of not receiving proper SM treatment as a child, knowing your life could have been different, right? Especially when seeing younger generation success stories. So like, what does that look like for me? And I think that's a really, really important question. That's a question that we get a lot. I would say a lot of our older teens, young adults, and even into our later adulthood population sometimes asks us. And I think it's definitely a great question to like dive deeper into. What I would say is, every individual is different and everyone's journeys look different. And I think that what maybe you worked through as a child might have looked different than someone who worked through maybe some more of their SM treatment as a child. But the idea that you're succeeding and you're finding a lot of this success now and you're working through some of these challenges is such a great thing. And I also think that treatment and success look different for everyone. And so, maybe there were barriers at various times of your life, but the idea that you're so self-aware now and you're finding various ways of success show that you're probably right where you're supposed to be, and it's probably part of your journey. But I do think that we have gotten many individuals that will say, I've seen so many success stories of like a 6-year-old who overcame their SM, and wow, that's so great that they didn't have to work through some of these challenges throughout high school. But again, I think that some of those obstacles make us more resilient, make us stronger, and it's part of our story. And now we can kind of reflect back on that, and see kind of the success that we've overcome, but also recognizing that like, we can't really, as much as it's hard to do, we really should try our best not to compare ourselves to other people, because as I keep mentioning, I think that we all have our own journey. I don't know if there's anything, Dr. that you wanted to add, but I think that's definitely a frequent question that we get a lot.
I mean, there was you, as you were saying it, I was writing down some notes, and you basically said what I wanted to say, especially about the resiliency. But I want to reassure listeners, one of the things that I feel sets me apart when I do these podcasts is my 30 plus years of experience working, frankly, with this population over the course of my medical career, thousands and thousands of individuals. And again, as we talk about, we do a lot of work with teens and adults. One of the only centers that works with teens and adults because they found us and it's one of our specialties. And I want to reassure those individuals that are feeling this way, that having worked with so many, that it does make you stronger. It's part of your journey. And although that may not help you completely, what I want to tell you is that you can overcome this and reach your capacity. How do I know this? Because over the many, 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 many years I just shared, I've seen it happen countlessly. And the most important part is your internal motivation for change. Very often, young kids may not have that internal motivation. Parents do. And as kids age, it either gets stronger or it gets weaker, that motivation for change. And part of that is due to the acceptance, meeting an individual where they're at. Again, can go on and on about that. But I want to reassure those that feel that sense of grief. Guess what? This is the beginning of the next step for you if this is where you're starting. Whether you're 10, whether you're 15, whether you're 20, whether you're 30, whether you're 50. We've worked with individuals that are adults and they have said all the areas of their life that they have struggled with and how sad that is for them when they hear these, success stories. But what I want to tell you is step by step by step, we look at what is important for you. What do you want to do that you cannot do? And we're here for you to help you. And the key is step by step. It's not just diving into the deep end. It's how do we find peer connections? How do I assert myself? How do I become more initiative? How do I become more elaborative? How do I leave this present job, if I have one, for something that
Mhm.
I know I can do better? How do I pursue my education in an area of interest when I'm afraid? How do I join that outside club or activity?
Right.
How do I go up to a peer and start a conversation and ask someone for a get together? How do I assert myself with family members? How do I do it? How do I do it? That's what we're here for.
Yeah.
And
Yeah.
so many times we just hold your hand and you just walk with us through this. We
Mhm.
help you.
Yeah.
So finding that treatment provider that can not only treat, but be your coach and really help you. What else are you thinking from that? Because this is a theme, and I'm really glad that we got this question because it's also the grief that comes along with finding out the diagnosis for a child
Yeah.
and how to deal with this. My friends have kids who, don't struggle at all with social interaction and communication. How do I deal with this? My child has a diagnosis.
Yeah.
So we see the grief come about in so many different ways.
Yeah.
So how about let's branch off into that. Talk about that a little bit.
Well, before we get there, I did want to kind of add a little bit more into like the older population. Two things kind of came up when you were talking. I think the first thing is this individual, when I was looking further at their question, was mentioning a lot of, shared that occasionally they would get upset knowing that their life could look different with an early diagnosis, but instead they used, they had years of ineffective play therapy. And then they only began really talking in school in sixth grade when they were forced to. So
I
they
hate that word. You know that,
yeah,
right?
yeah, and this is what the individual said that
No,
they
of course. I
but,
just, oh,
yeah, but I do think that when I hear that and just emphasizing what you mentioned earlier, I think you mentioned this a lot in like various podcasts, but that idea of like quote unquote ineffective play therapy, right? And we get this a lot where we have people come to us and they'll say, I've been in treatment. I just worked with someone actually who is now 20, was in treatment since they were 4 and is still and still struggling a lot and has said, yeah, we've been in therapy since 4. And I'm like, okay, well let's talk about that. Like what have you worked through in therapy, right? And I think that it's so important to find a provider that understands, that really can help you, guide you through. I think you mentioned this a lot, Dr. E, how when we talk to even treatment professionals or school teachers in school, and they'll say like, when can we expect our kid to speak? Is it going to be, let's say they're a second grader, is it going to be by fifth grade? You're like, wait a minute, with the right interventions and with their right capacity, they should be able to overcome and work through a lot of these things this year. Like we can work through this now. And so I do think that sometimes there is a little bit more of that decreased expectation when maybe people don't feel like we can succeed even further. So finding that person that knows your capacity is really important. But the other thing is, I have a college student that I'm now working with who, really struggled like throughout her whole life. And we kind of talked a lot about that now that she's overcome her selective mutism and is working through her other anxieties. And we talked a lot about how sometimes I notice that she minimizes a lot of her progress. Like she'll talk about kind of the previous goals that we've worked through, where maybe we set a goal where 5 times a week, she's going into a store and saying thank you to the store clerk, or we're working through various moments of her initiating, can I have an extra fork at a restaurant, right? And again, we do that because real world exposures are practical, they're predictable. So sometimes we focus on that. But now that she has overcome a lot of that, she doesn't really remember it being as much of a struggle. And so she'll minimize, like, oh, well, like that's not a big deal compared to what other people go through. And I'll say, well, in that moment for you, that was the biggest deal, right? Like you were really stuck within your own world for a long time. And we shouldn't minimize that. So yes, you've overcome a lot of that. And now you're, becoming a young adult. But, I think I would say to a lot of the listeners that maybe are feeling that grief piece is there's probably a lot of small successes within that window of time. And to remember that, because I think that sometimes when we reflect back, we tend to think more about those negative feelings. Unfortunately, I feel like negative feelings have a heavier weight than some of the positive feelings, but within there's probably a lot of trickles of that positive feeling. And I think that's important to kind of reflect on, just to kind of build up more of like your confidence and esteem, because that's also part of your journey too. So I just wanted to highlight that because I think it's important not to minimize, some of the goals that you would set back in those days?